Polycystic ovary syndrome. It is the disorder of females which is produced by the hormonal imbalance, and its age of onset is at puberty, that is at the time of menarche. It's stored from this period. There are two ovaries that produces ova for fertilization and the resulting in the pregnancy. The various female reproductive hormones, they are produced and controlled likewise hypothalamus that secrete gonadotrophin releasing factors or hormones. These stimulate the anterior pituitary gland and that produces luteinizing hormone and follicle stimulating hormone. These two hormones, they act over the tissues of the both ovaries and they produces the female hormones, that is the estrogen and progesterone. These two hormones are called as the female sexual hormones. They are responsible for the production of feminine sexual characteristics which appear at the age of menarche in the females. So these are produced within the ovaries by the particular cells pertaining to the production of these two hormones. But there is a limited or the least quantity of production of androgens to make the balance between the hormones and their effects. So in this syndrome, there is disorder of the menstrual cycle in the females due to the imbalance in the hormone productions. This syndrome is produced by the over-secretion of androgen within the ovaries. The cells which produce androgens, that produces the male characteristics in males. So those limited quantity of the cells, they become overactive. So there are many theories which has been forwarded by the researchers, but up till now there is no discrete or the final etiological factor which is responsible for production of this syndrome. First is the genetic, that is familial predisposition of this syndrome. There is gene mutation within the cells that produces the estrogen, progesterone in normal person, I mean the females. So the various factors or the elements responsible for this mutation, in addition to the genetic factors, familial predisposition, that is the extrinsic factors called as the environmental factor. The main is frequent attacks of acute and chronic inflammatory process within the pelvic organs, or the irradiation or the radiotherapy in the pelvic cavity to other organs, or the surgical or the external traumatic injuries. So they attack or disturb the DNA of the cells which produce normally estrogen and progesterone in the ovaries. They are distorted. They are mutated into the abnormal DNA, that is the DNA which is producing, they are responsible for the production of androgen hormones. So these tissues which normally or physiologically produces the female sex hormones estrogen and progesterone, they are converted into the DNA which is necessary or responsible for the production of androgens. This conversion of the DNA or mutation, so that produces overproduction of androgens. This is the main factor or a hypothesis. Next is there is extra secretion of the insulin hormone, because the cells of the body organs, they become resistant to the insulin. They don't allow the entry of the glucose within the cell for production of the energy. So they become resistant. They don't obey the effect or the order of the insulin and they don't open the gateway for the entry of the carbs. So there is accumulation of the elevation of the level of insulin. And this insulin elevated level, that also stimulates the tissue that produces the androgen. It also enhances the production of the androgens. So these androgens are the male sex hormones. They produces the sexual characteristic in females just in the pattern of males. Next factor is obesity, diabetes, overweight. These are the extra factors or the predisposing factors. They also enhances or are responsible for the production of the PCOS. So due to these factors, genetic, inflammatory action, due to the immune system overactive in this process, that also the damage the normal DNA of the cells of ovaries producing the female sex hormone, I mean the estrogen and the progesterone. So they are converted, the DNA is converted into the DNA of the androgen producing cells. So this is the basic concept, which may be wrong, may not be accepted by some researcher, but collectively or finally it is the overproduction of the androgens which is responsible for production of this syndrome. So there is overproduction. So the male hormone, they produces changes, like there is acne over the face, excessive growth of the hairs like mustaches, beard, chest, just like males, male pattern. So there is darkening of the skin below the neck, in the armpit, in the groins, below the breast. There is also retarded development of the breast, unlike the normal females that appears at the menarche. So these changes which are normally, they should be present normally in young female at the time of menarche, near about 14 or 15 years age, they are not fully appear. There is also disturbance or irregularity in the menstrual cycle, menstrual period. There may be oligo, poly or dysmenorrhea. The cycle is prolonged or shortened. The period is prolonged or shortened. There is irregularity in the menstrual cycle and the system. Due to this upsetting or the abnormal production of androgens in the patient. So then these androgens, they retard the development of the normal ova, which is produced normally by the ovary for the fertilization and for the appearance of the pregnancy and the birth of the baby. So they depress the production of the normal ova. So multiple immature ova, they are present in the follicles with some liquid or fluid and they appear on ultrasonography, they appear as cysts. That is why it is termed as polycystic ovarian syndrome. And they are non-functional. They cannot produce or cannot be utilized in fertilization. So normal ova are not produced usually in this syndrome in the female suffering from this disorder. So they suffer female infertility.